Welcome back, Richard. It's good to see you on this
Hey,
first weekend of July.
What'd you say? July?
First weekend of July.
Okay, all right.
Yeah.
Ready, blazing through the year, halfway.
Yep, we have just passed the halfway mark, and summer is speeding through for students.
It is. Summer is definitely here, right? That's all we're talking about is the heat this summer.
Oh man.
Here and in other states, we know it's hotter this year than ever. Hot and humid.
It's tough, but so today we're going to talk about we're going to bring back a topic that we've talked about really many times.
Right.
We've talked specifically about oppositional defiant disorder before,
right?
But we're going to talk about it today again because it just seems as though over the past few weeks, we've talked about schools and we've talked about some of the challenges that people are seeing in schools. And one of those challenges has to do with students' behavior.
Right.
And so that oftentimes raises a question about oppositional defiant disorder. And I don't know about you, but I'm seeing many more patients who come in with either a formal diagnosis from another professional that says oppositional defiant disorder, or the parents have just sort of Dr. Googled it and found this diagnosis and say that their kid has ODD.
Right. And in the past, when we've talked about it, we've struggled a little bit with this diagnosis because it's really just bad behavior. I mean, it's negative behavior. It's not really what we would consider a medical diagnosis. Like ADHD, we think of it as a neurodevelopmental disorder or anxiety or depression. This doesn't feel like it fits into one of those categories. This is just about that small group of children who are just very difficult to manage. They're very willful, very headstrong, and it manifests as oppositional and defiant behavior.
Absolutely. And one of the problems that we have with it is that to be diagnosed with oppositional defiant disorder, it suggests that the child is being willfully disobedient. They're being intentionally disobedient. And that is really in the eyes of the beholder in some ways.
That's right.
If you give a child some directions and the child doesn't follow the directions, well, you have to assume that they heard the directions, understood the directions, knew when to do the directions, and had the attention and focus and lack of impulsivity or the impulse control to be able to perform and follow those instructions. Or you say that they're doing it on purpose.
That's right. And I think that's a key point, is that we expect all children to be a little bit stubborn, a little bit oppositional, a little bit, they're gonna do things we don't want them to do. We're talking about a group of kids who are at an extreme, and they're always misbehaving, and they're always challenging, and they're always defying you, or that's the way it feels, and it does feel intentional. Right. And that's the other assumption, is that for some reason, with kids with ADHD, well, it's the ADHD. He doesn't have any impulse control. With these kids, they're just being bad.
Right.
And that's what adds a layer, and we need to be very careful about that assumption, because that assumption leads to some parenting errors that we probably should avoid.
Absolutely. So, and as you said, it's a relatively small portion of the population, though there are some estimates that take it up to maybe 1 in 10 kids.
Right.
But again, depending on the research that you read, anywhere from 2 to 11% is said to have oppositional defiant disorder. And again, whether all of those truly have oppositional defiant disorder or if it's something else, we're not sure. But we do know that it declines with age. As the child gets older, they tend to those tendencies tend to decrease. We also see that the age of onset, there's usually one of two times: either it's really early, maybe even in toddler or early childhood years, or in the early teens. Right around just as the onset of puberty or so.
That's right. The terrible twos and puberty. If
Right.
those are the two times when we see an increase in these kinds of behaviors.
Yeah.
And when we talk about these kinds of behaviors, we're really talking about three core symptoms: anger and irritability, argumentative and defiant behavior, and vindictiveness or revenge seeking. And those are the three things that most parents talk about. There are a number of other characteristics, but those are the three that we commonly run into with these kids.
Right, right. And when we talk about those common characteristics, what we're talking about are characteristics or behaviors that would fall into one of those three categories. So lots of temper tantrums, arguing, refusing to do what they're told to do, pushing or questioning rules. But, again, now we get into some of the more subjective things like annoying others, intentionally angering others, speaking harshly to others. Those types of things are a little bit more subjective because, some people just talk differently, depending on, certain characteristics. But, those are some of the things that we see with kids with oppositional defiant disorder.
But the reason we have an older sibling is to torture us. I mean, who doesn't have an older sibling who didn't torture us when we were little? So what's the difference between that normal, what we would consider normal torturing a younger sibling, and something that feels pathological or feels extreme? Where is that difference? And sometimes it's hard to make.
Yeah, I think that was the first time that quote has ever been used on this podcast, normal torturing. We'll have to keep a hold of that one. But there are other comorbid tendencies that we see with ODD too. And again, I think that this complicates that diagnosis even more.
Right.
Because about 40% of kids with ADHD also have a diagnosis of oppositional defiant disorder. And again, many of the characteristics of ADHD are the characteristics of oppositional defiant disorder, but depending on your perspective, your evaluation of the behavior, you're either going to say that it's because they're not paying attention or because they're impulsive, or you're going to say that they're willfully disobedient. And to me, it's a very fine line that I have a hard time crossing sometimes.
Right. Now, I always say, if you have ADHD, you probably have ODD because it looks very much the same.
Right. Yeah.
So you got to be careful.
Yeah, absolutely. And so, lots of kids with oppositional defiant disorder also present with anxiety, obsessive compulsive like tendencies, learning disorders, mood-related disorders, all kinds of different things. And like we said early on, the prevalence of ODD decreases with time, but there is a small percentage of these individuals who grow up to become adults with this. Now what tends to happen, not always, but what tends to happen is that oppositional defiant disorder will evolve over time into, back in the day, we would say that about 1% of those with oppositional defiant disorder would then present with conduct disorder. And that 1% or so of those would evolve into antisocial personality disorder. So it's a small portion of people who do that, but that can happen.
That's right. And that's what you need to be mindful of, is that in most cases, these very willful kids will continue to be willful, but over time, society has a way of sanding off those rough edges, schools and sports teams and other people in their lives begin to sand that stuff down. But there is about 30%, maybe 1 in 3, if they start breaking societal rules and laws, whether it's in school or in the community, then they can end up getting a diagnosis of conduct disorder. And that in turn can, if that doesn't change and they continue rule breaking and breaking laws, by the time they're 18, the diagnosis of conduct disorder changes to antisocial personality disorder. So that's the one thing that we need to be careful of, is that if you have a child that you think has oppositional defiant disorder, is we have to make sure, how does it change over time? Does it diminish over time, or does it get worse over time?
Right. Now, the important thing that everybody wants to know is, like, what do we do about it?
Right.
Well, when we think about recommended interventions, the first thing that we should say, like right off the bat, is that there's not a medication for this. There are no medications for oppositional defiant disorder, I think that that's why we often see it co-diagnosed with ADHD, because with ADHD you get you have the stimulant medications to help with some of that impulse control and all of that. But for oppositional defiant disorder itself, there is no medication. And so our primary interventions are parent training and therapy for the child.
Right. And the parent training with these kids, I mean, if you want change to occur, we are going to ask the parent to change something. The
Right.
parents have to change something if they want the child to change. You can't, especially a young child, 3 or 4 or 5, you really can't reason with them. And so it's a matter of training the parents to manage the child's behavior in ways that are more effective. Okay? So that's the parent management part. Psychotherapy, whether it's cognitive behavioral therapy or family focused therapy, school-based interventions, are all useful, except with very young children.
Right.
You can't use cognitive behavioral therapy with a 3 or 4-year-old because they don't have the language structures to do that. So when we talk about interventions, these standard recommendations that everybody makes, but the treatment you use will depend on the child's age.
Right.
One of these things you can use with older children that you can't use with younger children. But the other thing is the child's temperament.
Right.
If a child is oppositional but has an easy temperament, you're going to be able to use some recommendations. If a child has a very difficult temperament and is overreactive, then you're going to need to be careful about some of the recommendations that might be made. So your child's age and your child's temperament are 2 important considerations to make.
Absolutely. So we have those issues to consider. The severity of their symptoms also will influence what type of treatment you choose to do, because if the child refuses or just will not, once again, we're talking about the idea of having people, meaning children, change the way that they're doing things because we're telling them that the way that they're doing it isn't effective, but the way that we want them to do it is effective,
Right.
meeting their needs, and they may just disagree, and if they just disagree for whatever reason, it makes it all the more difficult. So, and lastly, the thing that influences the treatment considerations really is those comorbid conditions. If a child also has ADHD or learning problems or anxiety or depression or something like that, that makes it all the more difficult, because now you're trying to figure out what to deal with first and how to manage all of that.
That's right. You're dealing with a couple of different things.
Right. Yeah, absolutely. So what we want to get to is, okay, so what is our advice? What do we recommend to people for dealing with, if you have a child who is oppositional, who either has a diagnosis of oppositional defiant disorder or who just is refusing, presents with all the symptoms, but just hasn't had the diagnosis. There are a number of things that we try to recommend. And the first is, as difficult as it is, I took a deep breath before I even said that, as difficult as it is, you have to be persistent and consistent.
Right.
Parents have to be, you have to be the broken record, and you're just doing it the same way every time and keep doing it the same way every time.
You don't have the luxury of saying, I'm just worn out, I'm just too tired. You cannot say that. You have to be there every day.
Well, and it's inevitable when we talk to parents, and it's certainly not every parent, but many parents with kids with oppositional defiant disorder, what we find out is they start out holding firm to their expectations, but they'll say, if you question a little bit farther, they'll say, well, yeah, there are times at the end of a hard day, or, he just doesn't stop. And eventually I just say, fine, whatever.
Right.
And as soon as you do that, that just maintains the behavior, that just keeps it going. You have to hold firm.
That's right. As soon as you give in, they have found the release valve. They have found the opening that they've been looking for. You cannot send up the white flag. We're going to talk about that later. But when we talk about being persistent and consistent, you do that based on the child's temperament. So you have to know Is this child easy temperament, difficult temperament? But you also have to know their reactivity, I call it reactivity quotient. How quickly do they light up? How quickly do they ignite? How quickly do they become really dangerously aggressive? Okay. And you have to know this child. And so you begin with that. And then also is that you need to ensure that parents are the decision makers. The easiest thing is to give up. And you simply can't give up. But it begins with, are your expectations reasonable? And are your expectations age appropriate? Because if you're asking any child to do anything that is not age appropriate, that is beyond their ability to do it, you're going to get pushback. Okay?
Right.
So you're persistent and consistent with this particular child, and you have to know who this child is. So yes, but begin with that. What I would advise is, don't go into it, I've had it, I'm gonna defeat, I am going to do whatever it takes. Don't even think that way. Think in terms of, this is a marathon and I have to pace myself, and I have to manage my own expectations of what I can achieve. So yes, be persistent and consistent, but don't hit the red button. Don't ring the bell. Don't give up, and don't panic. This is going to be a very long process that you're going to do every day.
Right, right. And you know, there are some theories to say that the reason that we see these oppositional behaviors starting and emerging at the times that we do is because their brain is changing at those times, and they are adamant that they can do things themselves and they don't need help and they know best and all of that. But as we wrote about in our book, you have to weather storms. You know, you have to be prepared to manage those times that are going to be difficult. You know, if you tell your child to clean his room and he says no, okay, you can hold some punishment, you can hold some, but there isn't much that you can do. If the child is completely adamant that no matter what you take away, no matter what you do to him, no matter what you say, he's not going to clean his room, I don't know how you make him do it.
Right.
You know, you can, not that we would ever recommend this, but you know, you can spank your child all day long.
Right.
And if he chooses not to clean his room, he's just not going to clean his room.
Right. Unfortunately, we sometimes face that situation, and they're really, I mean, you're going to get to a point where there is nothing you can do. And I think that's the time to call a professional, because you don't want to give in, you don't want to surrender, but you are then going to need you're going to need some help dealing with that. So.
Absolutely. And so we have to work to adjust in all. So we want to be persistent and consistent, but we also have to recognize that there are times in battles that we fight and those that we don't fight. We don't have to bring down the hammer with every single thing.
Exactly.
We can, and as you said, you know, making sure that our expectations are reasonable. We don't have to have the same level of expectation for every single piece of their life. We have to have some flexibility with some of those things.
That's right. So we begin with, there are two times when this happens, the terrible twos in puberty, but that's when the brain changes. So, and kids become more competent, so they want more control. Second, you have to be prepared for, they are trying to separate and become independent. At both stages, the terrible twos are, they want to be independent. Puberty is, they want to be independent. And you have to anticipate that. And so your parenting has to change. We talked about willows and oaks, the two trees, when the hurricanes came. Oaks are very strong and sturdy, but they fall over during a hurricane. Willows are wispy, but they bend. And we want parents to be more like willows than oaks. Don't stand there until you're knocked over. Don't be that strong. Be a willow. Be more flexible. And the third consideration is, what is this child seeking? What is the oppositional and defiant? What are they seeking? Kids behave to get their needs met. So this child is behaving in a way that there's some unmet need. And so part of your parenting is to try to figure out, what does this child need that I'm not providing? And how do I provide it in a way that's acceptable to both of us? Right. So the first thing, so first is be persistent and consistent. The second thing is is be careful how you respond. How you respond is absolutely critical. And responses fall into three categories: punishment, consequences, and responses. And so you have to use all three.
Right. Yeah. And so we did a whole series of podcasts recently on punishment, and well, punishments and consequences. But, the idea of punishments, of course, is, squashing or ending undesirable behavior.
Right.
But what that often suggests is I'm going to do something to snatch your attention. And
Right.
oftentimes it means I'm going to do something to hurt you, whether that means taking something that's valuable, something that you want, or spanking you, in many families. But I'm going to do something to hurt you, to help you understand. I suppose that's a nice way of saying it, to help you understand that you need to stop behaving that way.
Right. Right. Or that you need to do something that I want you to do.
Right. And you really have to be careful when you're
Right.
using punishments, because for many of these kids, yes, we will acknowledge that oftentimes they are effective in the immediate, in that exact moment.
Right.
You're right. Spanking your child probably will stop them from doing what they're doing. However, if you pause and ask yourself, how many times have I had to spank him for that same thing? Then you realize that it's not very effective.
Right.
Because if it was effective, it would work over time. You would have only had to do it one time, and it would be effective. But it's not. And so I say I have to, I spank him every time he does this, and he just doesn't get it through his head. Well, okay, well, we need to find a different way to get it through his head.
That's right. And you risk creating an adversary. If you want to hurt your child, whether it's physically or emotionally, or by taking something they really like, if you want to hurt them, if you say, by God, I'm going to inflict enough pain until you get the message, okay, but you do it at your own risk, because you could create an adversary. Remember, you're already dealing with somebody who's oppositional and defiant. Right. You start poking them too hard, you're just going to increase the oppositionality and the defiance, and you're going to create an adversary that you don't want to have to deal with, because they're going to make life very difficult for you. So be very, very careful with punishment. When we talk about punishment, we're talking about reducing a behavior, not hurting a person. Right. So even if you feel that you need to resort to spanking, maybe, but be very careful. You shouldn't do it after age 5. Any spanking you want to do has to be mild and light and just get their attention, not inflict pain. But it has to be done before age 5. But be very, very, very careful when you start hitting a child. That can end up in some very bad places. There are other better ways to accomplish what you want to accomplish. So be careful with punishments.
Right.
Now, so parents say, but we have to have consequences. And then I said, Berney, tell me about consequences.
Sure. Well, consequences are great. There's, and what we really have to understand is that there's always a consequence. Even doing nothing is a consequence. But right. what we have to consider is that when the way that most parents think about consequences is it needs to be more than just saying I'm the boss, right, or because I said so, or because that's what, because I'm an adult, and when you're an adult, you can make these decisions. We have to move beyond that. And we would like for parents to recognize that many times kids would do what you expect them to do if they can. If they can do it, they will. So many times we should begin with what skill are they lacking? What am I asking them to do that they're just not able to do? Go clean your room, and you go in there 10 minutes later and nothing has changed. Well, you could say that's oppositional, or you could say, maybe he just doesn't know where to start.
That's right. You have in your head what it means to clean your room. That doesn't mean the child has the same vision, has the same image.
Yeah. So he walks into this room that looks like a tornado hit it, and he's supposed to know where to start and how to get it going. Now, as an adult, I mean, I know that I've looked into, parents will show me the picture of their kid's room. They'll bring it in and say, look at this room. And I look at it, I'm like, I don't know where I would start either.
That's right. That's right.
And
The
so you
skill
think of
they're
an
lacking.
8-year-old trying to walk in and do something about it. How is he supposed to know where to start?
Yeah, I think every house has a place where stuff accumulates. And, like ours is a kitchen near the laundry room. And it's sort of, we put it all there and with the intention of taking it to the laundry room or the garage.
Right.
And it has a tendency to keep growing. And there are times when I look at all that and I say, I don't even know where to begin. So maybe the skill the child is lacking is, where do I begin? And they need help with, you need to teach them where to begin. I think of Marie Kondo. Why is she so popular? Because we all have this tendency to be overwhelmed by our stuff. Well, why should children be any different? So you say, go clean your room. Well, maybe they need a junior Marie Kondo to say, first you do this, and then you do this, and then you do this. This is how you declutter a room. We teach adults how to do that. Why not teach kids how to do it?
Right. So when we think about consequences, we should think about teaching and helping them to understand what the expectation is. It should be natural, it should be logical, and it should be stepwise so that the kid can understand.
That's right.
The third area is just a broad category that we're referring to as responses. And sometimes the best response is no response.
Right.
Sometimes when a child behaves poorly, it just doesn't really require a response.
Right.
Because now you're just drawing attention to it.
Yeah, we everybody knows to get rid of temper tantrums, you ignore them. Okay. That's not the only thing that you can extinguish by ignoring it. And you can ignore a lot of behaviors and they'll go away if you ignore them. So you don't need to keep responding to all behaviors. Remember, your children want your attention. And if it means doing something dangerous or defiant or destructive, they're going to do what they need to do to keep you in their orbit. And so be careful about always responding to everything they do. You don't need to respond to everything.
Right. Absolutely. Just stay calm, explain it once, maybe twice. But then after that, it's just, no, we know, you know what the expectation is. No, this is how we're doing it. So,
right.
So the last area that we recommend for parents, and we may end up having to come back and visit this in more detail on another podcast, because the last area has to do with timing.
Yeah, let me if we're going to do that, and I think you're right, we don't want to try to pack too much into this, but under responding, you are, number one, you can ignore things. Number two, you're not obligated to respond to every statement your child makes.
Sure.
We all tend to talk too much. We all tend to preach. We all tend to lecture. And invariably, children will challenge their parents. They say, well, you didn't do this, or you said you were going to. You're not obligated to respond to every one of your child's statements, okay? Because statement one, your response leads to their response, leads to your response, leads to their, that's never going to end well. Okay? Right. There's no obligation for you to respond to everything they say. You don't need to explain, justify, rationalize more than once. Okay. Once you've explained it, you don't need to keep explaining and re-explaining and taking all the little nuances and get into some argument with a child or a teenager. And you should only do that when you're calm.
Right.
When you're aroused, that's not the time to do teaching. Right. When you're aroused, that's not the time to make a point. You don't need to justify, just stay quiet. Right. Your child can only argue if you are arguing with him or her. Right. If nobody else is taught, they're not going to argue. They can't argue with it. They can't argue in an empty room. Right. You have to create an empty room. You don't need to respond. You're going to feel the need to respond, but you don't need to, because none of that should happen unless you're calm. Finally.
Yeah. I'm glad, just one more point with that, because I'm glad that you went back to that, because I think that you and I had this conversation the other day because of some of the, I think I said that I have a gaggle of 4- and 5-year-olds that I'm working with right now. Yeah, and we, for a long time, and I recognize the confusion that this could present for some people, because it's confusing for all of us. There is a balance that we have to find. we often talk to parents about being more authoritative as opposed to authoritarian, right? So authoritative is explaining and helping make sure that the child having strict rules and guidelines and expectations, but working to explain and make sure that the child understands, and teaching before punishing, and all of those things, as opposed to authoritarian, which is because I said so, and
Right.
I'm the boss, and those kinds of things. But there's a line in there where parents can go too far on the authoritative side to
Right.
where we are putting ourselves in a position that again is just repetitive, redundant, and frustrating for all of us, including the child. You don't need to sit down a 3-year-old and explain to them for 30 minutes why they shouldn't hit their brother.
Right.
No, the rule is we don't hit each other. That's it. It doesn't have, we don't have to go into it hurts him. How do you like it when other people hit you? We don't have to keep going into all of that. The rule is we don't hit, because hitting is not nice.
And
Period.
then your child says, yes, but there is no yes, but.
No, right.
I don't care. It doesn't matter.
Right. It doesn't matter if, and we want our kids to understand, and that's terrific. But the main thing that he needs to understand at that age, at that level, is the main thing you need to understand is no, we don't hit. That's it.
You're not a lawyer, you're a parent, and you don't have to respond to every objection. You don't have to respond to every piece of evidence. Right. You say this is hitting is not, biting is not allowed, hitting is not allowed. You can't break windows. I don't care what the reason. You can't break a window. You can't damage, you can't hurt other people. You can't hit other people. There's nothing left to talk about. Right. I love the phrase, no is a complete sentence.
Yeah.
Because I said no.
Well, and that is, of course, right. That exactly. That is after you've explained it, and you know that the child understands what you're expecting of them. Mm-hmm. I don't like the idea that, the child says, well, why can't I go outside and play? Because I said no. Okay, well, that's not very good, because you want the child to understand, well, you can't go outside and play because in 30 minutes we're expecting a thunderstorm to hit, and okay, well, now that makes sense. But to say no when the child is asking for the 10th time, can I have a candy bar before dinner? No, the answer is no. It's already been explained. That's it.
You've explained it, and your child is going to try to draw you in, to weaken you, to wear you down, to where you give up. That's what we're saying at the beginning when we said, be consistent, be persistent. Do not give in. Do not say, oh my God, I'm tired of dealing. Just eat whatever you want. No, that's not how parenting works. You have to hang in there. Okay? Absolutely. You have to, and you don't need to keep explaining and explaining and explaining. It reminds me of the first rule of sales is you find out what the customer's objection is, and then you deal with that objection. Right. And you just keep looking for more objections until they don't have any more. That's what kids are doing to you. They're acting like little salesmen. Well, let me see which objection I can manipulate. Okay. The only way to avoid that is to not let it start to begin with. Right. You give you say, no, you can't do that right now because we're going to have dinner in 30 minutes. Mm-hmm. That's the end of the discussion.
Absolutely.
That you've explained it. You've done your due diligence. You have given a rational explanation, very calm, and said, no, sweetheart, we're going to have dinner in 30 minutes. So we're not going to have snacks right now. That's the end of the discussion.
Right. Yep.
No matter what else the child says, doesn't matter. You're not going to change. You're not going to change your mind.
Right.
Goodness knows you shouldn't.
Hopefully you won't. So, all right. Well, I think we'll wrap up there. Next week, we will come back and we'll talk about some of the nuances of oppositional defiant disorder at different ages, because the timing of and age of the child makes a big difference when it comes to how we're managing it and what we're going to do about it. So next week we'll come back and talk about age-related differences and issues with oppositional defiant disorder. But for now, focus on these strategies or these ideas that we were talking about today, being persistent and consistent, and making sure that you respond in a way that's going to not further the behavior, but also not have just the intent of hurting, and not teaching and not making sure the kid understands what to do. So
that's right. Yeah.
right.
Yeah. Keep in mind that this is a very long process. You're not going to get immediate success. You're not going to get permanent success. There's no home run here. There's no hole in one. There's no home run. It's just something you're going to have to do every day, and you're going to have to do it in a mindful way, and realize that the children are trying to wear you down until you just till you surrender.
Right.
The only thing you can't do is you can't surrender.
Absolutely. We also may have we also may return to the old ways next week, and that is
That's right.
Since the beginning of the pandemic, we've been using Zoom like this for recording our podcasts, and we may be back in the same studio starting next week. So we'll see how that goes.
We learned how to do that. Then we had to learn how to do this. Now we have to learn how to do that again.
Right.
So part of the pandemic challenges.
For those who watch on YouTube, it'll be we'll see how it goes.
That's right. That's right.
All right. Well, until then, until next time, stay happy, stay healthy, and forget to be afraid.